Hello, I'm Andrew Kane from calmerpatients.co.uk, an online CPD module for dentists on hypnosis, rapport, suggestion and relaxation techniques to help you calm your anxious dental patients. In the last video, we looked at trance states. In this one, I'll explain how that relates to hypnosis, what hypnotherapists do to help someone with a problem, and what you can do in your practice. If you'd like more about this, then check out the online course at calmerpatients.co.uk. Whether it's mild or severe, dental anxiety is one of the things that's stopping many of your dental patients becoming the patients you love to treat and look forward to seeing. The ones who look after their oral health, attend regularly, and are pleased to see you and value and take an interest in what you have to offer and recommend you to all their friends. Patients mainly don't know how good your technical skills are. What they do know is whether they trust you and whether they feel comfortable with you. Building trust, reducing nerves, and creating a great experience are what make your practice stand out. So let's talk about hypnosis. In the last video, we looked at how trance is a natural part of our experience, how emotional learning takes place unconsciously outside our logical awareness, how emotions constrict our ability to think, how expectations prime us to focus only on that evidence that backs them up, and how this all creates a self-reinforcing subjective feedback loop of experience that can be quite different from what's happening objectively, which is what we call trance. Hypnosis refers to engaging with that way we naturally create our subjective experience. It can be done formally, and I'll show you a couple of examples of that in the e-course, but more everyday examples tend to be informal. Sometimes it's done by someone else, like when a charismatic leader whips up a crowd into acting a way it never would logically, or when a salesperson or advert starts making you believe and feel that you really need a product that previously you didn't even know existed. And sometimes we do it to ourselves when we start demonizing someone we're angry with and making them out to be much worse in our heads than they really are. Or more beneficially, when we immerse ourselves in a helpful visualization. In therapy, hypnosis means facilitating the patient's creation of a more useful subjective reality. First, that means letting go of emotional learnings that are no longer helpful, like a fear connected to a previous bad experience that isn't relevant anymore, for example. And second, it means learning new ways to think and feel in situations, like hearing the sound of a drill and being okay with that. When people ask about hypnosis and trance states, they often ask about being out of control. In fact, though, when your patients are anxious, they're unwittingly hypnotizing themselves into an anxious trance, the distorted subjective feedback loop that's happening to them that makes them perceive an innocuous appointment as being something genuinely dangerous. And most repeated problem behaviors form a kind of a trance. When someone rationally knows it would be better to do one thing, like stop smoking, finally sort out their finances, or feel more confident talking in public, but in the actual situation they find themselves doing exactly the opposite, reaching for another cigarette, doing anything except their finances, or panicking during a presentation. So a lot of what hypnotherapists do is to de-hypnotize someone out of a problem trance, to help them break out of the automatic unconscious pattern and remain their normal, calmer, more logical selves at the time they need it. Hypnosis helps patients let go of past programming that's no longer helping them and gives them more choices in the future. So that's what hypnotherapists do. But in your day-to-day practice, you're probably going to be focusing much more simply on giving your patients sound advice and helping them feel as relaxed and comfortable as possible while they're seeing you. And a good starting point for that is suggestion. You might already use it as part of what you say if you use relative analgesia. I'm going to recline the chair now. It can feel like you're lying on a beach. I'm switching on the light. It can feel like a bright, warm sun. Or even when you say you're going to feel a little scratch. In all these cases, you're suggesting to a patient how they can mentally process an experience, the emotions and associations they can bring to it. The sensory input they get can remain the same, but the way they experience it can change enormously. This is how hypnosis can be used to help someone change their perception of pain. It's how it can help a patient change how they feel about what's going on, and can change a patient's associations about what things mean. I explain various ways you can begin to narrow a patient's focus of attention and create a relaxed, positive feedback loop for them in the e-course. So if you'd like more about that, check it out now at calmerpatients.co.uk. It will give you a clear understanding of what's going on and some easy, practical ways to start building relaxation techniques, hypnosis, and suggestion into your practice, so you can start having the satisfaction and loyalty that comes from helping your patients feel as comfortable as possible when they're with you. If you decide it's not right for you, then there's no fuss refund guarantee, so there's no risk. You can find that and other resources at calmerpatients.co.uk.